This video will tell you how to care for your child after they have had urologic surgery at Seattle Children's Hospital. Urologic surgery is anything involving the genitals or urinary tract, which is where pee comes out. In this video, we will cover pain after surgery, fever after surgery, if your child feels nausea or if they vomit, what your child should eat and drink, what activities they can and cannot do, showering and bathing, and when to call us if you have a concern or problem. You can pause and rewind this video at any time if needed. Pain after surgery. We usually send your child home with the two medicines acetaminophen, also known as Tylenol, and ibuprofen, also known as Motrin or Advil. Give your child each of these medicines every 6 hours with a small amount of food. We recommend that you alternate the medicines so your child will take one of the medicines every 3 hours. For example, you can give acetaminophen or Tylenol, wait 3 hours, and then give ibuprofen. Wait another 3 hours, and then give Tylenol again. Continue this pattern for the first 2 days after surgery. On day 3, you can give the medicine only when your child has pain. Some children cannot take one of these medicines because of their age or a medical condition. If your child cannot take one of these medicines, it is okay to give just one of them. Fever after surgery. If your child feels warm, use a thermometer to check their temperature. Temperatures under 101.5 degrees Fahrenheit can be temporary and get better over time. Call us if your child has a temperature of 101.5 degrees Fahrenheit or higher. Try giving acetaminophen or ibuprofen to help with mild fevers. Nausea and vomiting after surgery. Your child might feel mild nausea and throw up in the first 24 hours after surgery. If your child does not have their appetite back or if they throw up, feed them a light diet. We'll talk about that next. It is important for your child to get plenty of water to stay hydrated. Allow their appetite to return over the next 1 to 2 days. Vomiting 4 or more times in 12 hours may lead them to not getting enough water and getting dehydrated. This may mean that they are also unable to take pain medicine. Eating and drinking. After surgery, start feeding your child a simple diet. This may include juices, Pedialyte, popsicles, gelatin or Jell-O, toast, crackers, pretzels, applesauce, clear broths or soups, rice porridge, and breast milk. Have them take small bites and sips at first. Avoid any spicy or fatty foods in the first few days after surgery. Activity. For the next 2 weeks after any surgery of the genitals or groin, don't put any pressure on the area between the legs, like bouncing your baby on your knee or having them sit in a bouncer chair, high chair, or baby carrier. Don't let your child sit on any hard surfaces or straddle things like tricycles, bicycles, playground swings, seesaws, or bike seats. School-aged children should not do rough play or contact sports like football, basketball, soccer, or softball for the next 2 weeks. It is okay for your child to be in a car seat because most of the weight is on their backside. You can hold your child with their legs together, but avoid holding them with their legs apart. Showering and bathing. Keep the area around the surgical wound clean and dry. You can use baby wipes or wet towels and give sponge baths after surgery. It is okay to take a bath or shower after 2 days. Avoid swimming or playing in outdoor pools and waters for 2 weeks. We'll talk about bandages, skin glue, and catheters in other videos. When to call. Things are going well if your child has mild pain controlled with medicine, has no fevers, is eating and drinking normally, has their regular activity levels, and is peeing and pooping. Please call us for the following reasons. Your child has severe pain that is not better with pain medicine, fever of 101.5 degrees Fahrenheit or higher, your child throws up 4 or more times in 12 hours, your child is not peeing and has a dry diaper after 4 hours. Let's review the major things you need to know. Give pain medicines for the first 2 days after your child's surgery. Start with a light diet. Throwing up can be expected, but it will get better. It is okay to take a shower or bath 2 days after surgery. Don't let your child straddle objects or put any pressure on their genitals or between their legs. Avoid rough play for the next 2 weeks after surgery. If you have questions, please call us at 206-987-2509, extension 4, from 8 a.m. to 4:30 p.m. Pacific Standard Time, or send us a message through your MyChart account. For urgent matters during nights, weekends, and holidays, please call 987-2000 and ask the operator to contact the urologist on call. Thank you for bringing your child to Seattle Children's Hospital.